Good afternoon, everybody, and thank you for joining us. I'm Beth Gaddis with Planet DDS, and it's my pleasure to be joined today by Dr. Sundeep Rawal with Aspen Dental and Dr. Seth Gibree with Heartland Dental. Unfortunately, Lori Diedrich with Ricka Benny Associates Family Dentistry is not able to join us today because she is under the weather, but I know the three of us are going to have a fantastic conversation. So thank you for joining us today, and if you don't mind, Dr. Rawal, could you give us a little bit of your background to begin with?
Sure. So Dr. Sundeep Rawal, Senior Vice President of Implant Support here at Aspen Dental. I'm actually a prosthodontist by training. I did my undergrad in dentistry at Florida and my prosthodontics at the University of California in San Francisco. And I have been with the organization for over 6 years now. And I just love to talk about all things going on in the DSO space, along with technology and obviously implant dentistry. So happy to be here. Thank you.
Wonderful. Dr. Gibree, would you mind giving us a little bit of an introduction into you as well?
Sure. My name is Seth Gibree. I am first and foremost a follower of Jesus Christ, a father of two boys that are 21 and 18. They grew up so fast. I've been married 27 years this summer. And so family first and kind of all that I do. And then I am Senior Director of Clinical AI and Innovation for Heartland. So basically I get to wake up every day and try to figure out how to make dentistry better for clinicians and patients. I had a group of practices I affiliated with Heartland 15 years ago now, and have just been able to kind of plug in different places where innovation especially kind of keyed in. And so it's been a great ride, and I really enjoy what we do. And we're in exciting times, especially when it comes to innovation and new technology and the development of things. And so I love to talk dentistry. I love to talk sports and life. And so I'm excited to be here.
You know, it's a really exciting time to be in the industry. And the way the three of us basically met is because both of you contributed to the 2025 Industry Outlook report that Planet DDS published earlier this year. So I wanted to say thank you for that. For everyone who is watching, if you haven't looked at that report yet, we're going to add the link to the chat. It includes data from an in-depth analysis of more than 4,000 dental practices and interviews with more than 20 industry leaders. So tons of great information in that we wanted to share with all of you today. Now, for this particular webinar, we wanted to really focus on the clinical and operational innovations that are happening in 2025. So let's begin with AI for X-rays. You know, Dr. Gibree, can you talk to us a little bit about what Heartland is doing in this area?
Sure. So like, I don't want to go too deep into storytelling, but part of what I was able to do years ago and part of what our team was able to do is we were always looking for new innovations. So things that were coming out, whether they were new products or just really evaluating the market for what exists out there. Because our belief is even if we're not involved with it, but if we're helping to innovate a product, so if our doctors are choosing not to do it, we're a doctor first organization. So the doctors have the ability to choose what products they use and those kind of things. We're always looking for options to give them of things. So in that process, about 8 years ago, we stumbled into some AI related, and we'll call it software development as it came to identification of pathology and things on X-rays. And so through that process, we were able to be involved with all the players that are out there now in the AI radiographic space when it comes to looking at X-rays with findings on them and talk to them and help them in the development process of what they've come through. So over those years, we've been able to figure out what's worked well, what hasn't worked well, what are the benefits, and really if there's an ROI related to using that. So how does it help doctors help their patients better? How does it help patients understand their care better? And so when it came to us choosing a partner, we chose out of the solutions out there, we chose Vidya Health as our AI clinical partner when it came to X-rays. The other products are great that are out there. I don't have they all do things really, really well. They're all similar in a lot of ways they do. And it's important finding a partner that works with you and is willing to kind of give feedback and be partners in this journey, so to speak. What we have found is, and I won't go into statistics and all that, but we found that patients that are shown their care or what the doctor is diagnosing for them within the clinical AI platform say yes more. So ultimately, as a clinician, you want, and as prosthodontist for Sundeep, is we want our patients to say yes because we know we're trying to help them get their care done because that's what's best for them. And so anything that helps in that communication process or helps in that ability for them to understand their need is different than us back in the day drawing on the patient napkin or drawing on the tabletop and trying to show them, okay, this is enamel. This is dentin. This is a hard outer shell. It's like an M&M, softer inner shell. See this gray cavity here? They always say yes, but they can never see it. And so being able to show them things in color and display things in a way that they understand. But the other thing that we've seen is we all make mistakes. None of us are perfect. We all get tired, and every patient's a one-act play. So in my mind, if I go in and see you, Beth, and it's a great experience or it's a negative experience, I can't let that affect the next patient. So I have to be on my game, so to speak, for every patient. And so the other thing we found about AI is it just helps highlight things for a doctor to go, oh, I need to just double check that, and I need to take a look at it. Whether they agree on it or not, that's completely up to them. They have clinical autonomy and diagnostic autonomy, and that's important to highlight. But what we found is that it really helps the clinician maybe kind of stay on top of their maybe fatigue, or you have enough patients say no. You're like, oh, I'm not going to necessarily tell the next patient about that because I don't want to hear no again. But it helps you kind of treat each patient as a one-act play. And I don't know, Sundeep, how it's going for you or what you want to feel.
No, I think we've actually had a very similar experience within Aspen Dental. We've been involved with AI diagnostics, very similar trajectory for about probably the same amount of time, 7-8 years. And we actually are close to announcing our partnership as well. And I think very similar thoughts behind why we want to use AI. I think obviously from the standpoint of being able to identify early on, so we can be more preventative in the care that we're recommending, and proactive versus reactive. I think the objectification of diagnostics, or at least being able to help educate and inform patients, these are really powerful tools. We all know that when it comes to clinical diagnostics across dentistry, for effectively hundreds of years, it's been very subjective, and in that, it's really hard for patients and even clinicians to kind of formulate a relationship wherein, there's any type of, objectification of what you're trying to accomplish. And so, from that standpoint, I think it helps to democratize diagnosis and treatment planning, and gives patients an added layer of confidence in their clinician, and also an added layer of confidence that, obviously the identified pathology is something that, needs to be addressed in some form or fashion, whether it's preventative or actually some sort of intervention to the teeth. I think it's also exciting is the fact that we're going to be able to use AI to also do things across support, training, education, like being able to help bring clinicians themselves into, I think, a more standardized approach to how they look at care. I think is exciting for me, because just like you mentioned at Heartland, we are very, very strong on, autonomy of clinical decision making. And so all of our clinicians decide effectively what the diagnosis is, what the treatment planning, how they want to treatment plan, what kind of recommended treatments they're going to do, the products and services, everything that they're going to do is clinically 100% autonomous. And so if you think about any organization at scale, whether it's one office with a few clinicians and having different opinions, or it's 500 offices or 1,000 offices, obviously there's a lot of variability that the patient can experience through that. So I think when we look at what we're doing from a point of care standpoint, what we're doing to be able to support and train and educate clinicians, it's really powerful to have the AI tools that are there. And what's really interesting to me, and I'm sure Seth, you've seen this, is 7-8 years ago, just very early on, we're like, this is coming. 5 years ago, 3, oh, it's getting better, but still not ready. 3 years ago, it's like, okay, wow, we actually have something that might be FDA cleared now. We can actually use it for the way we want to kind of use it. And now, like the last 24 months, it's just an explosion. And I think we're seeing that across artificial intelligence in all facets of not just dentistry, but life in general, right? When you think about the advent of generative and other AIs that are out there today. And so, from that standpoint, it's really exciting to me to see the rapid, pace of change, and now the use case and adoption that we can actually put to add value to what we're offering patients in their care. I think it's really amazing. And I think we're just at that tip of the iceberg, because everything we've just talked about is still on 2D AI diagnostics. And now we're obviously entering the world of where we'll be able to do this across 3D with CBCT information and intraoral scans and other diagnostic sets of data. So it's really an exciting time from that standpoint to use AI across diagnostics.
You both have been vetting this kind of technology for a long time. Can you talk a little bit about like what your process was? How do you in each of your large organizations decide what to go with? How do you vet it? Who do you include in your decision-making process?
Well, I think, man, there's so much Sundeep said that like I can piggyback on is if we think about it, ChatGPT just came out 18 months ago.
Yeah.
So you talk about the last 24 months ago, like nobody knew what ChatGPT was unless you were a beta user and tester. And then we think back about like you hear about the Reader's Digest story that was done years ago where they went to different dentists and got completely different discussions.
Yeah.
I always told patients it was if you go to 10 different dentists, you're probably going to get 20 different opinions because I mean, we support 3,000 doctors, 6,000 hygienists, and there's a lot of different perspectives. And so even as you talk about evaluating AI, whether it's with a scanner, whether it's potential stuff that's coming with CBCTs, there's some really cool technology like pre-FDA process that's going on now. To Sundeep's point, it's like really ramping up faster and faster and faster. I think one thing that we do that's been super critical is we solicit feedback, and I'm sure Sundeep and them do it the same way. Is whether it's our doctors, our supported doctors, or supported hygienists, we're involving them in the process, or even our business team members. So it depends on what technology and where we're applying AI into what workflow and what we're looking at and what we're helping develop. Then we'll bring in team members and clinicians to be part of that process. Because one, it's seeking feedback. Two, when you deal with change management, change is always hard. There's no easy button when it comes to change. I can tell you, even when I owned my own practices, how many things that I bought that just ended up in a closet. We used to just joke like they just become coat racks or whatever it was, and you spent $100,000.
You're lucky you had a closet. I had a whole room. I had a whole room collecting dust.
My closet became a room. Like in my air abrasion unit that I had to have, I didn't ever use. Like maybe for some sealants to make them hold better. But as we think about change and we think about new technology, it's important to try to handle objections before they exist as much as you can. You'll never catch all that stuff. So as you think about implementation and you think about change, it's important to solicit feedback from your team members so that you can at least plug and play to some degree. There's always going to be pain points. There's always going to be losses. And it's important to, like, we have these conversations with different vendors that all the stakeholders have to have something in it for them. And it's important that they understand the benefit of it because you want that to become part of their workflow. And so it's important to have systems in place, understand what your systems are, and understand how technology helps you within that system, if that makes sense.
Yeah, listen, I just reiterate what Seth said. I mean, I think the reality is there's a lot of organizations in the space now today, rapid explosion. I think for us, there's some self-limiting aspects to who we can even consider in partnership. I'm sure Seth feels the same way because, when you think about at scale and you've got, several thousand clinicians, across, all these offices, you start looking at things outside of just the core technology or the core product and service. You look at things like support and how are you going to, train and educate and upskill all these supported team members, whether it's clinicians, whether it's hygienists, whether it's other people in the office. And so there aren't that many organizations out there that are really able to, at an enterprise level, be able to support that. And it's really no different when you think about who could support 1,000, individual offices, right? Or, something along those lines. So, that list is relatively short. I'd say one page of paper, right? And then obviously you have to go through and look at obviously the actual, I think, core technologies and products and services to make sure that they're of value. And I think that is for AI diagnostics, we've kind of proven that in the industry now. And then I think for us, at least, it's really important to start looking at what will this do from a value add perspective outside the mouth, so to speak. Like, how easy is it going to be to integrate with our existing systems? How easy will it be to adopt and to Seth's point, you got to train it. Change is is the hardest thing we do is change management. And that, I think, goes from my experience as a small business owner back in the days, right, to, where we are today. Like, the reality is change is hard no matter where you are and you know how many people that are in your organization. But the reality is you have to look at who helps make that change, I think, easier, who helps to lower that bar or that learning curve of change. And then really comes down to, you know, what kind of support do they have against this? What are their training education resources? Then you have to look at the integration across your existing technological stack and platforms, and make sure that it's easy to integrate. And, you know, obviously just really, you know, distilling it down, if it's the best technology in the world, but we got to do 100 clicks to get to it, it doesn't help anyone, right? Because it's actually harder to use the technology. And so you have to start thinking about that experience. And then you have to think about the experience from the patient side of it. What are they going to get out of it? And then you start to aggregate, you know, all the pros and cons, and we bring in team members, you know, organizationally across multiple facets of the org, whether it's, you know, obviously clinical in nature, whether it's, you know, IT or technology in nature, whether it's, you know, product and the consumer experience. You got to bring all of the stakeholders together so that you can make a really great decision. Because the other thing I think that's really important is you kind of almost have to, you know, pick it and stick it, right? It's really hard to say, hey, we're going to do something and then pivot mid-course. You know, it's not, you know, 1 + 1 = 2. It's like 1 + 1 = 10. Like the change management across pivoting is really, really difficult. So, you know, you want to really make sure that we try to make the best decision up front that will, you know, hopefully, you know, be the right decision over time, right? So a lot of stakeholders come together to kind of make those decisions.
Yeah, and there was one quick point I wanted to highlight on that too is, and I meant to say it before and just totally lost my train of thought related to it, but it's super important how the models are trained. So it's like we think about, okay, we've got this AI and we believe this AI, but on the front end, the AI is only as good as the data they're using to train. Sure. And so those are things that we have discussions on too. And being involved in different innovation for a long time, those are conversations, whether they're a small company or a large company. And I agree that to support at scale is a different thing. A lot of like a startup right out of MIT, which a lot of these companies were, and been involved with them in a long time, but helping them understand how to support scale. That now doesn't mean never. But it's like a patient telling you no right now. It doesn't mean you're never going to do it. We're just want to help you innovate. And so our belief too is rising tide raises all boats. So there's enough business to go around for all of us in this industry. It's an important that as we innovate, that we can help other companies innovate well, whether they help us now or help us later or help challenge another company to grow in a better way because they've got a good product. All of that plays into it. But to Sundeep's point, it's like 3 clicks max. Yeah. Once you go over 3 clicks, they're like, we're out. But you also need to have IT and security because there's so many phishing schemes now and everything that comes along with that. And I think I saw recently, what was it? The average issue related to IT security in a medical office was pushing $1 million. Like that's really, really scary. And so the IT security component of it is super important to highlight too. And that's one of those things that we don't like to talk about, or we don't like, it doesn't fit with, workflows and patients and change management, but it also has to be secure from the back end standpoint.
I think you bring up a great point. I mean, obviously we're sensitive to that. You know, we've obviously had a previous exposure to
a hack or phish.
A couple of years ago now. And I mean, it's probably one of the most serious issues we faced, certainly since COVID, but I mean, probably in the last 20 years. And the reality is, I think that it's just more and more prevalent, especially when you think about, you know, we I think organizationally, as you gain scale, you know, attempt at least to be as sophisticated as possible. But the average, you know, clinician or practitioner certainly is less sophisticated in their infrastructure and systems and processes. So security is something that is, I think, really, really an important topic today. I think Seth brings up a great point.
Well, and that's why APIs are so important, you know, having that secure transfer of data. It used to be that some companies, some vendors out there would go in and they kind of like would scrape the data. Yeah. And, you know, it wasn't really an approved method. So by going through APIs, going through integrations, you know, where it is secure, it really makes a huge difference. And to that point, as I think about AI, you talked about how it began off as diagnostics to help with diagnostics for X-rays on like 2D, and now it's gone to 3D and intraoral and all of these other ways. You're seeing it now layered through so many other ways, going into predictive analytics. So do either of you use it for that way yet, or what are you hearing about in the industry about how you'll be able to use the AI data that you're collecting to help predict better patient outcomes?
Sundeep, have at
Yeah,
it. I'll let you start on that one.
Yeah, I mean, we're using it across, I think, the entire end-to-end solution. It's really amazing to me how fast AI is just changing everything in society in general, but obviously when it comes to the dental profession, we're at a watershed moment. I liken it to the advent of the internet, or relevant to dentistry. It's like when we hit critical mass with dental implants to change the profession and how we think about tooth replacement, or we think about digital technology clinically with scanning and milling and printing and all these critical mass events that have been happening over the last 10 years. We're at that critical mass event with AI outside the mouth. We're thinking about it inside the mouth is easy for us, especially as clinicians. Seth and I are like, oh, whatever's happening in the mouth, we can certainly understand, right? So if you got something that helps me diagnose a treatment plan, yeah. But really, from an end-to-end perspective, it's really, really changing quickly. And you're right, predictive AI is going to help us do everything from not just look at outcomes, right? Because outcomes, I think, certainly will be an important part of this from a prognostic perspective, and how we're, again, using that outcome data from a diagnostic perspective and recommending the optimal solution that we think will be the most predictable for the patient based on whatever those factors. And we can feed those models to Seth's point, and obviously aggregate data over the next, aggregate previous data and take retrospective analysis and the prospective decision-making. But I also think it's going to help us with every other aspect of the end-to-end solution across, the patient experience, from how do we, reach out to them? How do we meet the consumer where they want to be met? How do we message and drive value to them to get them to even show up to the office? How do we make that experience better when they're in the office? How do we get back-end functioning, scheduling, things that I think are the day-to-day grind outside the mouth of dentistry in general. I think all of that will be impacted dramatically by AI, and not that much time. To Seth's point, that it seems like ChatGPT has been out there for years, like, and yet it's like he said, it's only been 18 months.
Well, revenue cycle management is a gigantic area right now, where everything's getting automated and incorporating AI.
Absolutely. And so I think when you look at, can we use it from a predictive standpoint for patients? Absolutely. I mean, we can, but it's not just what happens in the outcome clinically. It's also like, can we predict, will these patients show up? Can we predict how much time they'll need for their treatment? Can we optimize their experience? If we know that it's going to, I'm going to make this up, but we know it's going to take 10 1-hour appointments prognostically to deliver, 98% of the time will deliver their care, we can set up a customized plan for them that meets them where they need to be met. Like, there's so many applications that we can use this for, that I think it really, it will change, I think, the delivery of care model for dentistry, in aggregate pretty quickly and pretty dramatically.
Well, and think about, like, even knowing who your best patients are. And I mean, those that show up on time, those who actually pay their bills on time and understand that. I mean, back to even your RCM conversation, there's so much that's happening on that front right now, as it's the whole revenue cycle. But even from a data evaluation standpoint, you're seeing Palantir and Amazon and Microsoft and Google all plugging into dentistry now. And I mean, we supported over 10 million patient visits last year. Mm-hmm. I mean, that's a lot of data to understand how patients interact, how care comes about. But it still seems like a lot of the processes from the business tool standpoint are still archaic. And we're seeing a rapid change in that, especially as it relates to revenue cycle, because instead of giving somebody a treatment estimate and saying, okay, this is an estimate of your benefits, or they even do a predetermination, and predetermination is not a guarantee of benefits according to the payers. But I mean, that's written right down there on your thing, but helping them understand what they're actually going to need to pay, and knowing in a highly accurate model what the payer is going to pay, what the insurance company is going to pay on that, and making that adjudication process smoother and easier helps your business team. And I would argue that the business team members up front have some of the hardest job. They're the first ones that the patient meets in your office. They're the first, hopefully, smiling face they hear both on the phone and see in person. But they've got a super stressful job because a lot of it is technical, and it has been for years. And then you're also trying to maybe present a treatment plan to somebody, and you're dealing with finances, and it's a lot of money to you, and maybe they don't get approved for financing or what the financing options are. So there's a lot of different variables that come into play for a business team member. And so being able to take a lot of their manual tasks, apply AI to those manual tasks to automate those both within the practice management software, but also from a business tool, from a data analytics standpoint, is a very valuable thing. And there's a lot of people that are working on that at a very, very high level right now. That's kind of, that's the teaser I'll give you related to that.
Well, and in the Industry Outlook report, we interview, folks from Dental Exchange, from Zentis, Teresa Duncan, who's an insurance guru in the business, to talk about some of the things that are being implemented right now, and to be able to take what used to be a 10-minute phone call, or having to go into a portal, or waiting on hold to get information.
Beth, 22 minutes on average. Sorry, not to correct you right there. Right.
Thank you. They're saying that now it will go down to less than a minute, that it'll be just automatic, and they'll be able to have all of that information at their hands to know what the limitations are, to know what the co-payment will be, to know if it's going to be covered or not. And all of that will be right there inside the patient's chart, fed back in through APIs.
But what gets me really excited about that is we're in a people business. Like, as much of the technical that we try to do, and that's, I think, what both Sundeep's organization and our organization try to do, is support doctors as they deliver the care that they're taking care of. So really, they should be focused on the people, and then we can help do these other things to help that out. Well, think about that team member that's doing a breakdown for 20 minutes on the phone. Or is it better that they're patient facing, they're relationship building, they're caring, helping care for people? And I think that's what the goal of what we do is. That we are in a people business. Our work has way more to do with people and than it does teeth. And so I think from a relationship standpoint, it's super, super critical that these kind of things help us be more patient and more people focused, if that makes sense.
Well, being more people focused, one of the other things I think is really cool that's happening in clinical innovation right now is Curodont. So do you both want to talk a little bit about that and how you're using it?
I was going to say either way, we can talk about it. Super excited about Curodont, and just thinking back for the years, how many times we watch something, or we apply fluoride, or maybe we do fluoride appliances at home to try to help change their salivary flow. We talk about oral hygiene instructions and flossing better and all that. But to be able to have something now that we don't have to watch things anymore. And so being able to, I think the combination of AI and Curodont is like, I don't know if you would want to go peanut butter and jelly or wine and cheese, depending on your day. Cinco de Mayo was the other day. Chips and salsa with margaritas. I don't know. But anyways, I think it goes hand in hand because Curodont works really, really well for regeneration of enamel. And we've found that out over the last over a year, we've been utilizing Curodont. And what we've found is that enamel-only lesions have a high success of arrest or regeneration using Curodont. So if you can use AI to identify enamel-only lesions, and then you can use Curodont as a back end on top of that, then you have a treatment option that we never had before. And honestly, what we found is that patients love it. They love the option of not getting shots, not getting drilled on, and we're helping restore the tooth to the natural form and function it was. When I drill on somebody, I always envisioned whether I was doing number 15 or number 18 or a front tooth, this being up on a big screen. So I was always trying to do 1,000% what I could do, the best I could do, polish it, but whatever I did, it was going to need to be replaced. And so that's what's super exciting about this, is that it can help bring things back to where you're not starting that process of tooth removal, of restorative treatment, which is going to just get bigger and it's the tertiary effect of it. So you're delaying that whole process. So no, super exciting times. And I'm super passionate about Curodont, and I'm super excited about the results that we've seen on it. We really did some studies on the front end before we started using it as a proof of concept. That's kind of how we start looking at new products, we'll do like a proof of concept. We'll obviously look at literature, make sure all the data, information, scientific stuff looks right. And then we'll do a proof of concept, check results of that, check clinician feedback, and then build from there. So no, super excited about Curodont, great product. I'll hand the baton to Sundeep.
Yeah, no, we feel the same way. I think it just goes back to this whole notion that we were talking about earlier of AI helping to objectify and proactively identify things that we can be more preventative in nature as opposed to having to be interventional, so to speak. And the reality is, if you couple the front end, which is diagnosing that there might be and identifying early on that there's something that could be easily targeted by a preventable measure, and then you actually have a preventable measure that's efficient and effective at that. I mean, that's really, I love the, peanut butter and jelly or wine and cheese. And so I think that this is a really great example of how innovation is giving you a kind of an end-to-end solution when it comes to a use case where you're on both ends of the spectrum, whether you're diagnosing or delivering care. You're able to merge innovation in ways that are meaningfully impactful to patients and obviously the doctors and teams that are delivering that care. And so from my perspective, we are really bullish on the use of not just Curodont from a preventative aspect. And again, I'm reiterating what Seth said about looking at the science behind it and ensuring the efficacy and all of the claims are actually of value, but really being able to marry that to something where we can use it at the right optimal time, which is preventative, early stage, where otherwise you wouldn't be able to identify until it was too late. And so I think this is just a great example of where the industry is going. I think you're going to see more and more of these kind of use cases across a lot of different applications where we're taking technology on the front end and diagnosing better or faster, more efficiently, more predictably, or more resolutely, and with a higher degree of clinical confidence. And then at the same time, have new innovations that allow us to deliver care in ways that are really meaningful and impactful to patients.
Well, and Dr. Rawal, in the report, one of the things that you wrote about was, when you go to the other side, when somebody has lost a tooth or teeth, and how implant therapy is really has evolved. So tell us a little bit about that and what you're seeing for this year.
Yeah, I mean, I think it's kind of a good segue from when you think about how we can use technology and innovation to be really preventative, but obviously we can't always be preventative, and you're going to have intervention. And the classic, I think, example of the most intervention you can do is in tooth replacement, right? And so when you think about replacing teeth, the reality is, I think implants have been for almost 40 years now the optimal solution for tooth replacement. But there have been so many barriers to absolutely adopting implantology as the right tooth replacement solution for every single patient every single time, because take your pick. Obviously the economics has been front and foremost, right? It's been an expensive, hard to attain treatment for a lot of people in society today. It has been hard in terms of clinicians being able to deliver it, because historically only a select few clinicians and teams were able to offer effectively implant therapies. It was technically hard for us to accomplish these therapies just from a pure clinical standpoint. It was challenging and cumbersome, which meant it took more time and investment just to provide that care, which translated to a higher cost for patients in general. So there's a lot of these barriers that, though we've known it's the gold standard for tooth replacement for decades, hasn't been able to easily turn that into a mainstream, easy application for people at large. And I think a lot of that has changed, especially in the last 10 years. I think when you think about innovation and you think about technology, certainly inside the mouth, no facet of dentistry has been more impacted by technological advancement than dental implant therapy. I mean, the last 10 years, you think about the innovations in technology for inside the mouth application. Implants are on front page of every innovation that's been out there. And it's really amazing to me. Like I'm an old soul. I've been doing this now for almost a decade and a half to 2 decades, which is kind of scary. It's been almost 20 years for me. And the reality is, like, I remember the days of, using things like gold and platinum and palladium and melting and waxing and casting and, all this time, effort, labor, and it was even that much harder for implant dentistry. And now I think about where we are today when it comes to the, ability to acquire data digitally and manufacturing innovations with, advent of 3D printing, a CAD CAM, 15 years ago. I look at where we are from the actual ecosystem of an implantable medical device and how far that's advanced. And then I think about ecosystem and workflow and how easy that is. And, what could have taken us, 2 years and, countless appointments can be distilled down now into a matter of weeks and, just a handful of experiences for the patient. Like all these things have helped democratize implant dentistry for patients as a whole to be able to get the best care that we know is available. And then you couple that with, hey, you know what? Can we get more clinicians doing it? Can we support them well? Can we educate and train? Because unfortunately, it's still one of the last bastions of this profession that are probably undereducated from a dental school perspective, right? And so the reality is the average clinician comes out learning about implants, but probably not ready to offer implants from a total spectrum perspective, right? And certainly not ready to leverage all the technology and innovation against that. And so if we can kind of bring those things together, you marry them into what has become at least, a huge focus for us as an organization, which is democratizing the ability for patients to get dental implant therapy to replace teeth.
So we have
yeah, go ahead.
It's funny, really quick, is like you made me have flashbacks. So about 25 years ago, my first day of practice, the doctor that I was an associate for had somebody flapped from ramus to ramus and was taking a subperiosteal impression with rubber base. Yeah. And now you have all on X with implants that are like this big. Yeah. That it's the process is completely different. So no, it's super, super exciting time. So sorry, Beth. I was just thinking about the transition within implants and now with CBCTs and predictive surgery models and guided cases, and even companies like Perceptive that are developing robots for implants. And that might have freaked some people out to see, but there's some,
it's definitely coming. I think the application of technology and implant dentistry, like I said, nothing has been more impacted than. And you look at diagnostics and what we've done with CBCT and 3-dimensional imaging and software, and just the level of fidelity we can get in diagnosing and treatment planning optimal outcomes for patients. You can't do that with natural tooth dentistry as well. It just doesn't exist for the natural tooth. But with tooth replacement and implants, we've had it now for a number of years, and it's really amazing the level of precision and accuracy we can get in diagnosing and executing a plan, and executing that plan through guidance with whether it's the gold standard is still static resin technology of a printed surgical guide because it's been around for 20 years. But then you think about dynamic camera-based navigation. You think about things like robotics. I mean, FDA clearance came for Neosis and Yomi back in 2017 now, right? It's almost a decade ago, right? It's just amazing how much of this has changed so quickly. And really it's exciting for me because being, somebody that remembers the days of just sludging through the mud in implant dentistry, all these little things you had to keep doing to kind of minimize the chance of error or correct an error. And now we have these wonderful, elegant systems that allow us to do things so much better for patients. It's amazing to me.
Beth's trying to get us to stop because we'll talk forever about this stuff. And like, we'll be like, okay, scanners precision is so much better now. And then we start, and then she's like, okay, people stop.
No, we have a question that came in from one of our viewers. So they wanted to know what your thoughts are on integrating telehealth and robotics.
Yeah.
So I was hoping that you might be able to.
I'll give you my thoughts on this one. I think robotics is the future of execution of care. And the reason I say that is because if you look at the end-to-end solution from diagnosis to delivery, everything we've been talking about from AI to manufacturing innovations is changing and allowing us to democratize how we go through that process and the outcomes we get, right? And standardize. It's no different. Like if you think about making a crown, and 20, 25 years ago, there was a lot of variability because whoever had it in their hand would be different than this hand. And so the reality was tremendous variability in the outcome for patients, right? In the product and actually the delivery of care. Then we got CAD/CAM, and now, 95% of every crown made is exactly the same, right? And maybe there's 5% difference in design or hand, finishing, but the reality is 95% of it's the same. And that's great for patients because that means the outcome is predictably better in aggregate across all of dentistry. That's what's happening in all of dentistry and in implant dentistry for sure. But the one spot that is still not predictable is actually the execution in the mouth by the clinician with the human hand. Still the greatest area of deviation in predictability because we're all human. So as robotics penetrates into the profession more, I think you're going to see that last bit of potential deviation from a predictable outcome get minimized, right? And that's going to happen across, obviously, implantology is one of the first places that it's been applied in dentistry. Like I said, Yomi's been out for, 7-8 years now, FDA cleared. To your point, Seth, about perceptive and what we'll probably be able to do from a natural tooth perspective in prepping teeth, right? I think endodontics, obviously oral surgery application, the list goes on and on and on, where I think robotics will help us minimize any chance of potential error based on using these two things right here, right? And then the other part of that question was what again, Beth? Remind me.
About teledentistry.
Teledentistry. Yeah, look, I think it will certainly continue to evolve. And I think teledentistry will become more and more prevalent when it comes to being able to do things like diagnostics, have the ability to engage with patients and show them value, differentiate yourself as a provider upfront, ultimately to get a more predictable path to get them into the office. I think it still will be hard for us to deliver care, so to speak. Most of the care we deliver for dentistry is still we're doing something in the mouth, right? And so, there's obviously oral systemic issues that we'll be able to maybe democratize through a teledentistry type perspective. But by and large, I think we'll be able to use teledentistry to help engage with patients, potentially diagnose and treatment plan, depending on the technologies that are applied, really be able to hopefully show them value to bring them in and complete the process. At least that's my take on it. I don't know, Seth, if you feel differently.
Yeah, I'll try to give you a short answer to this. Great question, Eric. So if we look at it at different buckets, I think it's important to remember, and this is one thing that I've positioned for a long time with innovation companies, is that clinicians are the ones that need to make the decision. So I think that's important first and foremost to highlight as it comes to robotics or anything like that, is that maybe I'm old school in a lot of ways too, but I just turned 50, so maybe I'm reminiscing also. But I think that it's so important that if we talk about AI and we talk about AI on x-rays or we talk about AI on scanners, they're tools. They're diagnostic tools to help you. Like I have loops, 3.5 loops, 4.5 loops. They're a tool. They help me see better. AI is kind of like, in regards to x-rays, is kind of like loops on your x-rays, help you see a little bit better. From a scanner technology standpoint, it helps integrate things a little bit more better. Robotics, especially in the lab side, is super, super critical right now. And it's helping build a lot of the next generation of labs as it comes to robotics, because there's AI used in crown design process. I was an early CEREC trainer and user, and I don't miss the prep, powder, and picture days. That was always what I told myself. I had to prep, then I had my powder, and then I had to make sure my powder wasn't gooped up anywhere and trying to keep it dry, and then take my picture, then work my design. But I think where telehealth can benefit, and again, I know I talked before about we're in a people business. And so for me, I don't want to lose the relationship of what we do because it's super, super critical. But where I see telehealth helping is like predictive aligner cases. So if you're doing ortho and you have a predictive case, you don't need to see him anymore. Like, people don't want to come in if they don't have to. And if you can help manage that case via telehealth, that's great. I think there's other components of telehealth within the medical system, like ER systems right now. People go to the ER and they have pain, they have an issue, but the ERs typically don't resolve them. They just tell them to go see a dentist at some point. So if there's the ability to capture diagnostics from an ER standpoint and then telehealth in with somebody, at least from a diagnostic tree, to help them understand, I think there's benefit from there. I am a believer that nothing is going to replace the brick and mortar side of what we do, because it's super, super critical to that. I'm sure that will be challenged in my lifetime, but right now I keep positioning with these companies that no matter what it is, it's an assist to help the clinicians help their patients. That's kind of the big way I position everything.
It really is incredible to see just all of the changes in technology. And, I think that 2025 is going to be a pivotal year as more technologies are evolving and coming out and being integrated and being tested. We've had a lot of early adopters that have tried some of these new technologies. And now I think we're really going to see them going into the mainstream. So I just wanted to thank both of you for joining us today. This has been just a fantastic conversation. And it was just a pleasure talking to both of you and hearing the two of you share your perspectives and sharing your experience.
Thank you for having us.
No, I really enjoyed it. Thanks.
For everyone who joined us, we invite you to check out the full 2025 Dental Industry Outlook Report, and you can learn even more from our panelists by reading their articles in there. Please visit planetdds.com, and you can find it under resources. Thanks again for joining us.